And now something completely different.
Good afternoon. I'm speaking to you live just outside
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hair loss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
What's up, Joe?
What's up, Spencer?
How are you, man?
Normally I'd say I can't complain. I think I'll stick to that. I'll stick to that story. Can't complain.
All right. What would you be complaining about anyway? I mean, I'm not talking about your personal life. That's, we all got shit we got to deal with.
The lack of situational awareness in this industry by the so-called professionals. How's that?
Yeah, let's talk about that. What professionals? You talking about the guys who are performing surgery, or the guys who are selling products, or both?
The ones that should be situationally aware, and that is the doctors.
Oh, shit. Are you kidding me, man? Excuse me. You made me choke. You think these guys know what the fuck is going on?
They're clueless. No, of course I don't.
They're hustling hair.
Okay. I know they don't, but it never ceases to, I'll say, catch me off guard at the severity of the lack of awareness, situational awareness. Like I'm reminded every once in a while of just how clueless a lot of these guys are and gals about their own industry, the one that they are the professionals in, that people look to them for guidance in about very important, situations, surgery, and they're completely unaware of their own industry.
Well, honestly, dude, if they knew what the fuck was going on, you would not make a living.
You have said that before. And you are not wrong.
That is the sad part of this reality. Do you think a college dropout like me?
Hang on, before you continue your point, let's re-examine. Just say that out loud. If they were actually aware, we wouldn't be able to make a living in this business.
That's right.
That is an amazing statement. That could not be more true.
When this industry, when I came out, and they tried to fucking, you talk about cancel culture? Cancel me. Do everything in their power to get rid of the bald truth. When Brad Wolf came to me many years ago and said, hey, you know what? I was at this conference. Matt Levitt told me that your boy Kobren is finished. I don't mind saying it. It's true. Or at least that's what I was told by Brad Wolf. And that they were arranging, allegedly, to have the sponsors pulled from our national radio show, who were two pharmaceutical companies. Think about that. Think about how fucking dirty that is.
Oh, it's, extremely dirty.
So I was like,
extremely dirty.
All right, thanks, Brad. Got on the phone. I'm like, all right, what am I going to do now? So I turned 3 markets, I think I was in 2 or 3 markets, into 27 markets in 2 weeks. I'm like, you know what? I'm just going to have to get on the phone and sell this show. And, the only way to do that is to go and find some new markets. So I got a broker, got on the fucking phone. Within 2 weeks, even before these companies were able to pull out, I had turned the business model over 27 times. I'm sorry, what would that be? Half of 27? Whatever that is. From 2 markets or 3 markets to 27 markets in 2 weeks. Can you imagine the faces on these motherfuckers?
Well, I'd love to be there just to hear the what the fuck.
I'm like, I was just like, oh yeah, thanks a lot, man. Hung up the phone. I went right to it. You just made me rich. Thank you.
Yeah. Yeah.
Anyway, that's the reality of this field. So if they weren't entrenched in the bullshit and the politics and all the happy horse shit, people like us would not be needed because they would be able to relate better with their patients. They would be able to guide them in a safer direction. They would be able to counsel them like a human being should counsel them. And I think I know what you're talking about, Joe. You're talking about what happened in that chat in that chat today.
Yes.
In the private chat.
I absolutely am. I absolutely am.
Canadian doctor.
One of the more important subjects in this industry is, and this is something for our listeners to really consider. One of the most important subjects is patient selection. And when you're dealing with patient selection as a professional, you're looking at several criteria. You're looking at the physiological candidacy
How's my hair,
of
by the
the
way?
patient. Out fucking standing,
Thank
by
you.
the way. I
Go ahead.
meant to tell you that.
Thank you.
You're looking at the donor density. You're looking at the donor expanse. Like, how far does the density extend on either side towards the temples, bilateral temporal area, all the way back around the occipital. You're looking at, if it's a strip surgery, you're looking at the laxity, the vertical movement, which determines how wide of a strip in various areas around the scalp can be taken. You're looking at the skin tissue. You're looking at the overall area of loss. You're looking at the donor supply versus donor need ratio. But you're also looking at the emotional state and perhaps the mental state of the patient. Not perhaps, absolutely. And those factors can actually, I actually think they're more important to assess than the physiological traits, because if the patient doesn't understand what they're getting into, or if they're too desperate to actually have surgery, then those issues can lead to absolute misery by the patient and perhaps absolute misery by the clinic. So if this aspect of the patient isn't evaluated properly, everyone loses.
That is
more
correct.
so than any other factor of the procedure. The consultation, the post-op follow, like everything else is secondary. And some of the people in this industry, I got to say, I honestly think it's most of the professionals in this industry, especially now because of the feast or famine attitude a lot of them have. They either don't understand it or they don't care. And at some point, it's going to bite them in the ass. And the sad part of that is if it bites them in the ass, it means that a patient is miserable because of it.
Well, there was the interesting story that I found it interesting that a guy, we were talking about patient selection, young person's parents in this chat was trying to get some advice about getting a hair transplant for their young son. The kid's like 17 or some shit like that. And there was a
he's 21.
21 anecdote
21.
or a story that was posted by an Asian doctor, I think, about a Canadian doctor who came. They were doing some workshop and told the story of a patient. He turned down this Canadian doctor turned down this young patient, rejected him for surgery, and the young patient then attempted suicide. And then the kid lived. Parents came back. Doctor felt bad for him. They begged him to do surgery. He did surgery. Then he comes back, lo and behold, with a fiancée saying how happy he is, blah, 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 blah. Now, that's wonderful ending to a possible tragedy. However...
Well, it's not the ending.
Right. It's currently the ending. However, if this physician would have, as opposed to just rejecting him, giving him no hope. And I had an interesting call today on the UK show, which is kind of similar. Giving him no option, basically saying you're just not a candidate, but not really holding his hand, not continuing on with the conversation, not saying, hey, you know what? And I've been telling doctors this forever. I have been, and now with you, Joe, for the last 5 years or 7 years or whatever,
7.
talking kids and their parents off the ledge for over 25 years, or close to 25 years. And it's not just you're not a candidate, don't have a hair transplant. You have to provide them with the insight as to why they just dodged a fucking bullet if they were rejected. And once you're able to provide them with all of that detail and let them have the opportunity to listen to other people, not read it on a forum or some shit like that, but actually hear other stories and our advice and why we're giving them that advice, and give them the opportunity to call back, I can guarantee you that this kid would have had it would have been less likely that he would have been thinking about ending his life if he had...
Softer landing, pardon the pun.
Right. Jesus Christ. Just shit, man. I'm like a 12-year-old kid, man. Anyway.
It works, though. It works.
It does. But the point being, if these fucking doctors, and I'm not talking about people who are attached to what we do. Everyone in the IHRS is like, yeah, go to the Ball of Truth. It's a great show. But the majority of people in this industry, as opposed to looking at the Ball of Truth as an asset for their patients and their practices, even if they're not part of what we do, they look at us as an enemy to their practices because they're not, in quotes, recommended, or they're not part of the IHRS, or, you know, they're afraid that if their name is brought up that they're going to be bashed on the show. He could have guided someone to an asset, to a resource that is there for this exact type of patient. So, what's going to happen now? The kid's all happy. He's got a fiance. Great. His life is set up for disaster.
Yeah.
Complete and utter disaster. I think that was a fucking terrible story, actually. And I think it really underscored, it illustrated the inability and the lack of social aptness, is that the term? Of so many in this field. The inability to really counsel these patients or give them the right resources. Anyway, it's all fucked up.
I lost my thought, but
so
I just remembered. It's going back to what you're talking about, where some doctors think that because they're not IAHRS doctors, that what was it you said? That
they feel
that if they're mentioned, they'll be bashed.
That they'll either be bashed on the program, or that why would they promote a program that isn't associated with them in any way?
Well, referring to that bashing comment, let me make something crystal clear. It doesn't matter if they're IAHRS doctors, hair transplant mentor doctors, which by default are IAHRS doctors. If anyone does something wrong and we find out about it and it's being discussed on this show, doesn't matter what memberships or associations you have, you're fucking fair game. That's like, so doctors shouldn't be worried about being bashed if they're not a part of our organizations. The only bashing will go on if they're just doing stupid shit.
Yeah, but that's that's the false narrative that's been put out there by physicians. You know, and it's also based on.
I know.
It's also based on
some. Clear.
It's also based on some reality of, you know, the old school forum shit that went on with the extortion, and if people didn't pay, their name was dragged through the mud online. I never forget this. And guys, hold on. We'll get to you in a second. I'm at a conference. This has to be 10, 15 years ago. I'm introduced to Robin Unger of the famous Ungers. We sit down, we're talking, whatever it is, and I'm like, listen, you know, anytime you want to call the show, come on the show. You know, you're more than welcome. And she says, I can't say it verbatim because it's so long ago, but she said something to the effect of, I was told that if I were to go on your show, or to be careful not to go on your show, because essentially I would attack her on the radio. And I was like,
Christ.
holy shit. I'm like, well, that's not the case. I wouldn't invite you on my program if I planned on attacking you. I'm like, attacking her? And I went off and I had a shot with Bauman. You know? But this is
that's what you do.
Yeah, but this is the mentality of these people. This is the false narrative that was created from the beginning of my career. And sadly, you know who's hurt at the end? Patients. Because if everyone just got together and said, "Hey, these are great resources. Here's some help for you guys." Yeah, Kobren's telling the truth, but maybe the truth isn't so bad in this case. Maybe it'll actually help our practices.
Maybe even, we don't always agree with what Kobren says or what Tillman says, but in general, it's good basic information. Like, even that much would be a step.
Fuck them.
But
let's take a call.
They can't do it. They can't do it.
Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hey, this is Andrew from Atlanta, Georgia.
Andrew from Atlanta,
Hello,
Georgia.
Andrew.
How are you, man?
I'm doing great. Thanks so much for having me.
Oh, sure.
Yeah.
Well, I am afraid I am about to go into some kitchen sink territory, so I thought you guys would be a good place to start.
All right.
Me from doing that.
Tell us first of all, tell us how old you are and what your situation is.
So I am 28 years old. I started experiencing hair loss probably when I was about 23. And just to give you the full context, in, I want to say, fall of 2017, I started taking brand name Propecia. Did that for about 3 years, and that entire time, in my opinion, I still continued to see like gradual recession and, loss of density. So I actually went to someone, Joe endorses, in Alpharetta, and he put me on a topical finasteride, minoxidil solution. It was actually a pretty high dose of finasteride, 2.5%. So he was like, hey, this is really going to work. Come back in a year and talk to us. So a little over a year I did, because I still was not seeing results. And with the little research I've done recently, there's this talk on the internet about like this 500 Dalton rule. And I guess they're talking about like molecular weight. And both finasteride and dutasteride are pretty high. I want to say like dutasteride is above that threshold. So I'm just trying to figure out now, like, what direction should I go? Should I try an oral dutasteride because that's a little bit more effective? It blocks both types of the DHT enzymes, or should I try the topical dutasteride? I recently got a tricho test and they were recommending that, but I'm just worried that I'm going to lose more time if I go the topical route. There just seems to be a little bit of like dispute amongst doctors. Like some say, oh, topical is the best. It attacks the problem at its source. Others say not so much. It still has to be processed in the liver. So I just don't know really where to go from this point.
I can tell Joe's chomping at the bit at this, but I will tell you this. I believe that topical finasteride, topical dutasteride, all these newer preparations, especially if they are compounded by the right pharmacy, can be incredibly beneficial. But I am not a believer that that should be that should only be your first line of attack if you are ultra concerned about potential adverse side effects. And I want you to think about how it would work. Even if there's some systemic absorption, and some of the newer companies are coming out with products that are claiming that there's less systemic absorption, the only place that the drug will actually work will be most likely in the places you apply the product. When you take something internally, and again, I'm not a physician, so doctors feel free to call in and correct me, but when you're taking something systemically, you are essentially affecting all of the DHT susceptible hair, and including what's considered to be a safe zone or DHT resistant hair, which is your donor area. So you have, in my view, you have a much greater opportunity to save all the hair that you have, or as much hair as you can, using something orally.
Gotcha.
Now, that's not to say that these topicals don't work, because I have seen them work. And I'm a fan of a couple of them. But to me, if it was my brother, or what, I'd be like, listen, you got to fucking put your big boy pants on and take the pill.
Gotcha. No, and you know what? I'm not totally afraid of the oral medication because I was on brand name for 3 years, 1 milligram a day. And now what I'm hearing is many doctors are saying, you know what, take finasteride three times a week. Per someone else's advice, what they're arguing is now take dutasteride once a week and then take your finasteride 3 times a week. The person that I've been seeing the last year doesn't seem to agree with that advice. But again, I'm just trying to find the right daily routine that will give me the most runway possible, because I don't think I'm a great candidate for surgery. I mean, if it's an option and someone's willing to do it, I'll certainly go down that route should I need to. But
someone's going to be willing to do it. Don't you worry about that, my man.
I'll rephrase.
Exactly.
Someone who's an authority in the field, someone I respect, someone who says we can accomplish your goals. But I'm not just going to go get any run-of-the-mill transplant, which is why this is so important to me, finding the right daily, weekly, whatever you want to call it, routine. Because, like a lot of guys have this mentality of, well, I'll just get the surgery if this doesn't work. And I don't think it's quite that easy.
Well, you're absolutely correct that it's not that easy. And most people don't know shit, sadly, and they get fucked up. Joe, I'm going to let you take it from here.
Thank you, Spencer. So here's my feeling on topical finasteride. And, you know, I find it interesting. There are companies coming out with new formulations of topical finasteride because they're trying to reduce the systemic absorption to get further away from the stigma of the side effects from finasteride. Here's the problem with that. Topical finasteride from the very beginning has had a very low systemic absorption. You won't find anyone, like if you go back online and do some research from 5 to 10 years ago when these things first came out, you won't find a single purveyor of topical finasteride saying, yeah, we're having problems with systemic side effects. Not one. Yet here we are in 2022, and there are new formulations out or coming out where that's one of their main selling points, even less systemic absorption than other topical finasteride offerings. I think that's complete horseshit because it wasn't an issue to begin with. There were some people in the past that did report that they had side effects, but I was involved in this over 10 years ago. And I remember early, we'll call them studies. I'll call them observations of, say, 60 to 100 patients that were taking one topical or another. And it was reported that maybe one of them had some sort of noticeable side effect. That's pretty good. Like, that's far better than what you're reading online with oral. If you're to believe all these people talking about their side effects. So I think that's all horseshit. What I think topical finasteride, as far as the biggest issue people need to be aware of, it's not so much the potential side effects or the lack thereof, it's the quality of the product itself. Because I've been saying since 2006, name brand whore, or if you do take a generic, make sure you know that's a generic that actually works for you. Now, you can't go online and say this generic versus that generic because Costco and Walgreens and all these different places, they don't talk about the brands that they're bringing in. So you don't really know unless you actually remember to look down at your box and see that it's from pharmaceutical company X versus pharmaceutical company Y. Like, most people don't even notice this. And your pharmacy, your big box pharmacy, they're counting on that. They're counting on the fact that you don't know, because on their end, the buyers for that company are trying to get better contracts with the suppliers of their oral or topical finasteride. So the main ingredients that go into whatever it is that they're offering you. And it's the same thing for the pills that it is for the topical. So when you see a topical out there, topical finasteride, you need to ask yourself, what's the source? Like, is it a reliable, good source of finasteride that will actually work close to or the same as the original?
And see, I never.
But the problem is you don't know.
From my doctor. Yeah, I don't know. He just uses the pharmacy in Atlanta that he's partnered with or whatever. I don't know how that end of the operation works, but it just says the pharmacy's name on it, and they make it there.
Well, here's the good news. Here's the good news for the future of you guys. We are working on some stuff where you guys will know, and I'm making it very clear to those who are manufacturing certain products and who want to be associated with us and the American Hair Loss Association that we have to understand where these products are being sourced from. And for several reasons, but now I have heard, I've been in talks with some of the bigger subscription companies, and one of the biggest issues for me as far as working with them is, at least initially, they were very resistant as far as providing where they got their source material. And I'm not just talking about the drugs themselves. I'm also talking about, the different materials that are used within the drugs, and including where the bottles are made, because if there's anything leaching in from the containers, that could actually affect, especially if containers are perhaps made in, I don't know, China or someplace, that could actually affect the efficacy and also potentially be toxic in some cases, depending on, I'm not saying any of the brands out there are using any toxic materials, but that is all potential that none of you guys think about. So,
right. I mean, I never even thought about the container. I mean, I've always been very, very cognizant, like when I was taking the oral stuff, like where it was coming from. I recently switched I'm back on oral finasteride, and I asked the pharmacy, I'm like, this is generic. Is this a good source? And they said all of our suppliers have to reach this 90-something% threshold of being almost identical to the brand name. Now, I don't know if that's true, but that's what
that's not. How is that true? When legally they only have to go within a 20% variable. That's either, and usually it's probably usually around 15%, on average, maybe 10% in some cases, but they have up to a 20% variable, and also they're using different fillers. So, the main drug, the molecular, what is it called, Joe? The molecular structure of the particular drug has to be within a 20% variability of the brand name. And then you throw in a bunch of different fillers, you don't know what the fuck it's going to do to your body or how your particular body is going to react compared to somebody else's. So the consistency is going to be all over the place. That is the reality when it comes to generics. Now, with that said, generic drugs in general can be a lifesaver for many people. Yeah. But you just have to kind of understand that, when people contact me and they're like, I've been on finasteride for 7 years and all of a sudden, I'm losing ground, what we say. What's the first question? The first question is, were you switched? Were you on brand name or were you on one generic and switched to another? I would say 9 out of 10 times they were switched to another brand of a generic. So your story is interesting because you were on brand name, you said.
I was on brand name Propecia once a day, and in my view, I continued to lose ground.
Right, and that's possible, That happens to people. You weren't a great
How often
responder.
were you taking it?
Once a day for 3 years, really. And that's when I went to John Cole, and he was like, well, let's go the topical route and see if you respond this way.
Which, by the way, it's reasonable.
It is reasonable, and I know that he's a big believer in topicals, and he has been for a few years.
Huge into topical finasteride.
I'm actually a big believer in it, too. I've seen it work. Yeah, I don't want anyone to come away with the idea that I don't believe in topical finasteride or topical dutasteride, but you kind of have to.
By the time I'm done with the show, they will,
because they just have to know, look, this is how these products work, and to me, this is the reason why you would go topical. And
I'm using topical myself right now.
Yeah, I know that.
Oh, okay. So it's not a side effect.
I obviously believe in it because I'm using it myself. What's that?
Okay. So why did you change from, because you took the oral for many, many years, correct, Joe?
I did. And the reason why I switched, like I didn't want to talk about this much before, and I'm not going to get too much into it because I don't want to influence anyone with
junk
regards
shrunk,
to like
dude.
the brand I'm using and things like that. But I switched to topical because I kind of wanted to see if I could feel a difference. Like I don't recommend anyone do this. Like if you feel fine, then stick with what you know. But I have access to so many different things, being having the position I have in this industry, and I saw this opportunity, or it was presented to me, and I thought, you know what? I'm reading good things about this. Like I'm talking to one of the doctors involved with it, and I know I can trust at least the baseline of what I'm being told. Because there's more than one person involved with telling me about the product, and again, I'm not going to get too far into it, but I decided to try it, and I was very hesitant. I was actually almost manic about it. Like, am I doing the right thing? Am I going to fuck it up? Like, you don't want to fuck something up, and I didn't. I didn't screw it up. I really like it. I like it not just because I think that it's still helping to maintain what hair I have left around the fringe. It's helping to prevent the sides from dropping in the back. But I do think that as a styling agent, I really think it's great. Like Rob Helmner asked if anyone's going to be making it topical finasteride like minoxidil foam, Rogaine foam, and I think that this is kind of like that. It's a paste, not so much a foam, but it's like it's almost like what's Arm & Hammer toothpaste, soda toothpaste. It's got that grittiness to it, but it's such a fine grain grittiness that it's you don't feel it. You just rub it in your hands, and I concentrate on the areas I want to make sure I get the most benefit. But then there's still some residue left on my hands, and then I rub it through the front and the top with both hands. And then when I dry it, it's just got this feeling and this fullness that I don't get from actual hair product. I get it for a little bit from there's some dry pomades out there, like the Uppercut Deluxe, which is a great company out of Australia. They sent me a bunch of hair products to test out, and I really like their stuff. They also sent me a product that gives a similar result. It's a ocean salt spray that is amazing. I highly recommend it. That's Uppercut Deluxe. No financial affiliation. But yeah, so I changed it because I wanted to experiment on myself, and it worked out for the better. I really like the product. Is it the only product I'm ever going to use? I don't know. I may switch to another one because I know some other manufacturers that are supposed to be coming out with a really good product. Not just a great product, but one that has, I don't want to say a guarantee, but a reliable, two sources of reliable finasteride. So, I mean, we'll see. But there are things developing. I'll just kind of echo what Spencer said. There are things developing in the finasteride space, in the topical finasteride space, that are going to be exciting, I think, in the next several months. Maybe by the end of the year. I don't know. But if it comes out, if it's the way I think it's going to be, I'm cautiously optimistic, then you'll be hearing a lot more about it. I'll just say that.
That's great. Well,
that's great, but what about me?
But in the meantime,
yeah. what should I do? Well, I mean, honestly, maybe a different topical finasteride product would work for me there. But as the little knowledge I have in my experiences, I'm not a great responder to it. So I guess now I'm just trying to decide: do I go for a topical dutasteride from my current provider that I don't know where it's coming from, or do I try to find the best generic I can? Oral dutasteride, right. And if so, how long should I take it?
Well, how often are you taking the topical? How often are you taking the topical you got now?
I'm done with topical altogether right now. The only thing topically I'm applying is actually a 10% minoxidil solution with 0.01% tretinoin, because I've heard from another doctor I talked to in Australia that particular combination can help basically convert minoxidil into minoxidil sulfate and give you a little bit of a turbocharge if you're a non-responder to minoxidil. Anyway, that's all beside the point.
Right.
So I'm just taking 1.25 milligram of, because I'm cutting up ProScar. I'm taking that 3 times a week right now, but because that's all I've been able to get a hold of. I'm still trying to find someone who can get me a dutasteride of some sort.
Okay. Well, if it were me, and it has been in the past, like I had access to dutasteride and I've used dutasteride. That gave me more of an issue than finasteride ever did, and it was in the form of water retention. And if it were me today, and this is what I tell people usually, is instead of trying to keep changing things out, like different vehicles or different medication altogether, maybe try to adjust the dosage of what you're taking. Talk to the whoever your prescribing doctor is for whatever you have now, whatever you're using now. Talk to them about upping the dosage. Like if you're going to take oral finasteride and you're taking it daily, and you're taking 1 milligram, see if you can up it to 1.5 milligram or 2 milligram. However you can cut it, because that's what you wind up doing. If you're taking Propecia, it'd be 2 pills versus 1. But try to see if there's a balance that you can get with actually increasing your dosage. I've seen positive turnarounds just from that alone. So if you're fine with finasteride in either form, topical or oral, try do what you want to do. But if it were me, I'd try upping my dosage first before I'd introduce a new variable where I don't know if I'll have side effects or not. Like you're fine with finasteride as it is, so play in that arena a bit longer.
Right.
Yeah, you're trying to find the efficacy. You're not having side effects, so that's good. But the efficacy can come for some patients if you increase the dosage. Talk to your doctor about it. We're not doctors here, but that's something I've seen work in the past. If that doesn't work for you, if you get to something that's measurably significant more than what you're doing now, and after 6 months you're still seeing that you're losing ground, then you can think about slowly introducing something new into your routine. Never ever stop something cold turkey and switch over to something else. Almost guaranteed that you'll fuck it up somehow. That you could get, you could initiate a tilogem. I'm sorry?
Yeah, sorry, you were elaborating. I was like, in what sense? But go ahead.
Yeah, you can initiate an effluvium where you're shedding like crazy, and then you're like, wow, I really screwed up. Well, that's the last thing you want.
But how does this help me? Anyway.
well, that's kind of what happened recently. Is because I was on this. I was actually on a really, really high dosage of topical finasteride. Believe it or not, it was 2.5%. And if you convert that to milligrams, I'm horrible at math, but it's pretty high. And I was on that for a year and a half, and I just was not seeing any results, honestly.
How much did it cost?
The solution was like a little under $100 with minoxidil in it.
For how long?
A little over a year I was on it.
And how long did each bottle last you?
I would say a month and a half.
Okay, so you spent about $1,000. You there?
Yeah.
Yeah, so you spent about $1,000 on it.
Yep.
Okay. And so after you got off of it, you're recognizing that you're going through an effluvium. You went through a shed.
But not huge or anything like that. I mean, it just looks like my normal progression that I've been experiencing since 2017. I haven't had any major. It's very gradual. Like, and I'm also the guy that's constantly micro-examining their hairline. I mean, that's also like a huge component.
Oh, you're one of those.
You're one of those fuckers?
Yeah. It's the both of my doctors, I mean, John, I went back to him in November of last year. He was like, well, your number's great. You look fine. You might have a mature hairline. Who knows? My other doctor.
Your numbers are fine. Like, you look great. Get out.
Yeah, basically. And then this other doctor, Dr. Knudsen in Australia, I don't know if you're familiar. I really like him. He's awesome. He's like, you look good, man. Just you're fine. Just incorporate tretinoin in your minoxidil and also get off the phone because I have other things to do. That's basically been.
Let me tell you something about Russell Knudsen. That man can cut up a dance floor like nobody's business.
Really?
You can tell him I said that.
Well, tell him that.
Oh, yeah.
I will. I really, really like him, and he's the one who said, "Hey, man, if it were me, I would do oral finasteride 3 times a week and supplement a little dutasteride in there if you're seeing deterioration." So that really, really intrigued me, and that was one of the reasons I called you guys, is just to see what you thought about that.
Look, I like
another thing to consider.
I like Russell. I'm speaking, Joe. Jesus.
Go ahead. And we're listening.
Yeah. I like Russell. Good guy. Been around for a very long time. I mean, he's like one of the like super old guards. He's not an asshole. So he's a nice dude.
Well said.
Yeah. But I like Joe's advice, and I'm not a doctor. I like Joe's advice as far as like you've already been on finasteride. You know how you react to it. You know the side effect profile for your body at this point, at least on 1 milligram a day. I would talk to your doctor about upping the dosage. See how you do on a half of a Proscar tablet. Even if you up the dosage, do half a Proscar. I know this may not make sense, but do it like 4 days a week. You're still putting more into your body throughout the 7-day period. And that is something that I have seen, I've heard through callers work for them. So I think Joe's advice is pretty good. I mean, dutastaride's great. A lot of people take it. But, to incorporate the big guns, even if it's just once a week, when you may not have to, to me it's like you kind of want to have that as a reserve.
Sure.
But look, what do I know?
No, that's a great point. Again, my fault. It's just I've heard all these things for years that it can, block both types of DHT activity, and then now I'm in this black hole psychologically of like, am I suffering from the one type dutasteride will protect against, essentially? And I don't know. I've had yet to find a doctor who can really eloquently address that.
Well, and that's the thing. That's going to be impossible. And, the idea of blocking type 1 and type 2 5-alpha reductase, bringing your overall DHT levels down by, upwards of 90% or higher, it's very attractive. But there's also other potential risks involved that may not be necessary in your particular case. So, but I also understand the concept of not wanting to lose ground or time, because time is ticking, I get it. And you're like, you don't want to keep progressing and then feel like, oh, shit, I should have done something else.
Right.
So,
yeah, exactly. And this is why I've moved into the kitchen sink space of things. Like, one thing I sort of left out of the story just for simplicity's sake. So I told you I was on the 1 milligram a day brand name Propecia. Didn't work for 3 years, in my opinion. Moved to this topical finasteride, high dose of finasteride, minoxidil solution for a year. Didn't work. I did this tricho test that says you need to be on dutasteride. So I was on topical dutasteride for a month. And that's not even enough time to work. But then that's when in that month's time, I was finally able to get another appointment with John. And he was like, well, we can try this oral thing and see how it works, essentially.
Well,
so I'm really trying to avoid this. Like, I'm just in my head over the whole thing about, like, am I losing time? Like, what is the right move? And it's probably making the hair loss worse.
Well, it probably is, but you are losing time. We're all losing time. That's just the nature of the game, and that's the nature of hair loss. But I don't know if you're wasting time, and that's the difference. I mean, you've tried what you've tried based on not doing well initially on oral finasteride, which is or the recommended dosage of oral finasteride. Getting advice from a physician who's very well recognized and has a tremendous amount of experience and has seen these topical preparations work in his practice. it's hard for me to give you definitive advice on, jump on that dutasteride, because I have seen, just like Joe, guys who've upped their dosage of finasteride, all of a sudden, holy shit, it's working.
Mm-hmm.
So
I guess my question would be, why didn't it work with the? I know I'm changing two variables at once, and maybe that's the answer to my question, but I technically have upped my dose significantly of finasteride and saw no results. So, like, what could be a possible reason why that was the case?
I think the possible reason is that, like Joe said at the beginning of his monologue about, the absorption rate and everyone now coming out with where, you're going to have less systemic effects, is you're not getting the systemic effects, even from the higher dosage. So if you're taking something orally and you're upping your dosage orally, that's in your body. It's in your bloodstream. It's going through your liver.
So overall, oral is just a better way to deliver the drug, simply put.
I'm not a doctor or scientist, but I would say it's at least as long as you're not having any adverse effects, I would say that it's probably going to be more effective overall, at least for your overall scalp and for the long term. I don't know if you agree with that, Joe.
Well, I was going to say, depending on the vehicle, on how it's actually absorbed in the scalp versus into the bloodstream, no two topicals are made the same. Period. So, and that's the other problem I have with topicals is you're dealing with two variables: the finasteride itself, the source, and how it's compounded into the final product. Like what delivery vehicle. Everyone's got a different magic bullet for this. I mean, that's why, I like topical, but you gotta know which one works, and that's really tough. Like we have access to a lot of different resources behind the scenes where we do know the information, we can learn about this stuff, but the average person doesn't. And all you have to go on is what's publicly available. And what we know, we can't just start throwing this out there because then we're affiliated with these different brands. It's a whole thing. But
sure.
But you as a consumer, it's now twice as difficult to find something that you can say works for you, because you don't know the source of the finasteride and you don't know the vehicle in which it's compounded to actually deliver the finasteride to where it's needed most. With oral, that's pretty much already included in the question about the generic, about how it's compounded as well, because it's got different fillers and different ingredients that go along with the finasteride, and that's why I'm a brand whore. Like everything that's out there is trying to match the same efficacy and side effect profile as original Propecia / Proscar.
So the bottom line is
that's what I think about it.
We have no fucking clue, dude.
Awesome. So what I took away from tonight is hang on to your hair for the next couple months, because there's going to be some magical topical formula in the next few months. I just have to make it on my hair because I'm kidding.
I don't know about magical, but
and he was joking, and it was a good one. He got you, man. You see that?
Yeah, that was good.
Yeah, man. Look. If it were me, I would probably talk to my doctor about upping my dosage of finasteride, maybe changing. I mean, you're on brand, so I mean, yeah, I would probably do that. It may not be a terrible idea to get on the dutasteride if you really feel comfortable with it. Talk to your doctor again about it. But I would say that oral is the way to go. At least give that a shot. And, topicals are a pain in the ass. It works. I'm not saying it doesn't work, but it's a pain in the ass. And if you're willing to take the pills, then I would say take the pills.
I am. I mean, I don't know, maybe it'll bite me in the ass 10 years down the road, but I think I've been really, really lucky when it comes to all things side effect related. Even the brief period of time I was on topical dutasteride once a day, I didn't feel shit.
Yeah, I have no idea what's going to happen to me. So, I have no idea what this drug has done to me. I have some, minor issues here and there that I deal with, And is it because I've been on ProScar for 30 years? Probably not. But if I was the internet, I would say for sure. Absolutely.
Exactly.
Fucking drug fucked me up. But you know what? In my life, in my view, in my worldview, drugs saved my life, man. Changed my world.
Sure.
I wouldn't be behind this microphone. I would never have written a book, 3 books actually. I never would have done what I do if I didn't get my hands on that fucking medication that changed my life. So I don't care what anybody says. I love ProScar. Mm-hmm. I love Finasteride.
Well, exactly. I mean, maybe I would be 10 million times worse had I not been on it. Maybe it's just slowed it down, and for that I'm thankful,
Dude, first of all, I can't say that because that would be considered online misinformation. All I know is this. I have a lot of friends. They started it a little later than me, a decade or so later than me. They've all maintained their hair. All of them. One guy was going through hair loss aggressively when he was about 35. Like he went from, it looked like he was a Norwood 2 to, like a diffuse Norwood 4 in like a year. Got on the medication, reversed the miniaturization, grew a lot of hair back. Now he's an old fucking man like me. He's 56 years old, and he looks like he has, a little bit of a comb down, but pretty much a full head of hair.
Gotcha.
It works, man. And a lot of people just need to find the right dosage. That's my view.
Right. A
lot of doctors disagree with that.
I'm trying everything I can. John poisoned my mind because he says, I don't really see any miniaturization, but I see all these little short guys, and they're all anagen-looking hairs. They all look healthy, but they're short, and they won't fucking grow. They won't keep up with the rest of my head. So I'm like, now nothing's working, and I'm freaking out constantly. Oh, I see more scalp today. It's just, I live in this.
Yeah, but when they're that short, and correct me if I'm wrong, the base and the diameter is going to look very similar to telogen, or to hairs that are miniaturizing. So it's weird to me. I have to speak to John about that. Maybe I'm the retard. I don't know. Did I say that? Am I allowed to say that anymore, Joe?
Well, who knows?
On this channel, yes.
Apparently that's politically incorrect. And it's not that I'm talking about the mentally incapacitated or challenged. I'm talking about myself.
No, you're just talking about people like me who change medications every 5 minutes.
But look, I don't know if we've helped you, but all I can say is I get where you're at, and it's a fucked up situation to be in. But I still believe there's hope with the right dosage. And maybe eventually, if you talk to your doctor, you guys are comfortable. I see nothing wrong with adding dutasteride, but I do believe that you want to work with as little, that's going to affect your hormones as possible, especially in a something that has a longer half-life, that if you do have adverse side effects, you're going to have to deal with for a longer period of time, shit like that.
Mm-hmm. Makes sense.
All right, man?
Well, thank you so much. Next time I call in, we'll go down the PRP rabbit hole.
Oh, Jesus. All right. Let us know what you do,
times.
Man. Take care. All right.
Thank you so much.
Bye-bye. You got it.
Bye.
Bye-bye.
I was waiting for that discussion to start. Exosomes, PRP, oral minoxidil, laser caps. Thank God he's waiting for the next call.
Dude, wait till I start to sell my laser cap, man. It's going to be awesome.
You and me both.
You're going to see that shit on Amazon.
2 guys laser caps. I have 2 pictures of us.
I think 2 guys is actually taken.
Up.
I think 2 guys is taken. What is that? Is 2 guys a hamburger joint?
That's Movers.
Is it Movers?
Yeah. And there's so many variations on that. 2 guys in a kilt, 2 guys with big hearts.
Yeah, but who needs to trademark bullshit? Who needs to be possibly sued? Because if we put out a fucking laser cap, slap the American Hair Loss Association seal on it, that's going to be the one that sells. And everybody's going to, then we'll be a target for these assholes. So the name has to be right.
It does. before we get to the next call,
one guy and a Canadian.
I'd like to.
Sorry.
I'd like to encourage everyone watching this. I know the stats of who's watching, and a lot of you that are tuning in are not subscribed. So please help us get this channel larger than it is today. Hit the subscribe button, and to get notifications of the next episode, as well as new videos that's coming out on this channel, be sure to ring that bell. And if you get the clear bell, then you can right-click it and enable all notifications, and that way you'll get an email saying Bald Truth is going live in 30 minutes or whatever it tells you. Don't forget to hit the like button because it helps the algorithm say, hey, these guys are legit and will help increase the views. So we appreciate your support. We sit here on our asses for 2 hours every Friday at no charge to you, and we help you guys out. So we appreciate the support. Back to you, Spencer.
Thank you, Joseph. Let's take a phone call.
You're welcome. Okay, Spencer.
Hey, you're on the air. Who's this and where are you calling from?
Hello?
Hey, caller.
Hello.
Yeah, hi, can you hear me?
Yeah, we can hear you, kind of.
Quite well, actually.
What's up? Well, maybe you can hear him better than I can. Who's this?
Hi, this is Wayne from New Jersey.
Hey, Wayne, what's going on, man?
Hello, Wayne.
Oh, wow, I'm on the radio. Hey,
kind of.
Yeah, so, I had a hair transplant back in 2019 at Dr. Chinik's clinic in Istanbul, Turkey.
Dr. Who? Civis?
Yeah, Dr. Sinek.
Sinek. Oh, Sinek. Okay.
Yeah. Yeah. Okay. So I was Norwood 3, and I wasn't happy with the recession around the temple area, and then he filled in the temple area and he brought down the hairline. It looks okay, but the density is very low. I even had the DHT package. That at that time was the most expensive package.
What is it called? The what package?
The DHT.
DHT, direct hair transplant.
Oh, direct hair transplant. The most expensive package.
Yeah.
Sorry.
Yeah.
This
yeah,
whole fucking industry is so fucked up.
Yeah. Yeah, Dr. Sinek said, that option would offer me the greatest density, but it's been more than 2 years now, and I'm still not happy with the density. And Dr. Sinek did offer the option for me to have another hair transplant with him, and he won't charge me. All I need to do is just fly to Istanbul, and he'll take care of it for me. But I'm thinking, talking to another doctor, Dr. Bonsall of Eugenics, she was telling me that there could have been poor surgical techniques, and that's why there were some transections. And I was thinking perhaps I should go to Eugenics instead. Well, what do you think? Should I go to Eugenics, or return back to Dr. Sinek?
Well, I'm gonna make this short and sweet and let Joe handle the rest. Let Joe be the asshole in this one. But if you feel you're fucked up by somebody and you paid for it, you don't want to get fucked up again for free.
Yeah. But, the density is low. That's the only thing. Well, the hairline isn't too symmetrical either.
Look, if you bought the more expensive DHT package, God, it's unbelievable that they do it this way. First of all, every surgery should be performed in a manner in which is really of the highest standard of care. You shouldn't have to pay for a higher standard of care. That's what pisses me off.
Fuck. So in other words, you have the option to pay less. You have the option to pay less, and by their own definition of paying more to get good density, you can pay less and get shitty density.
Yeah.
So what you paid for one package, but you got the other one. So if it were me, I would call them up and ask that question. Did you guys give me the shitty density package instead of the higher density package? Just curious, by mistake? And if DHT is going to give me the highest density, how about if we get a double DHT Sapphire Blade package? Will that give me higher density? And forgive me, I'm kind of mocking them because This shit pisses me off. I did a video about this stuff, about the different marketing angles that clinics will take just to get you interested in them. And one of them was Sapphire FUE, which is complete horseshit. It's absolute horseshit. It's just a different instrument to make the incisions. That's a little bit different than a blade and a little bit different than a needle, but they all do the same thing. And in your case, DHT, that's another fraud with how a procedure should be presented.
Oh,
because
no,
you
he
don't
didn't.
get. Oh, the fuck I did. you don't go to a clinic and say, or you don't run a clinic and say, yeah, we'll give you a better result if you pay more. Every package or every option that's available should always be, as Spencer said, to the highest surgical standard possible to give you the best result possible. That just blows my mind that that's even an option. If you want better density, you got to pay more. Fuck you. Just charge me more for more grafts. Isn't that how it's supposed to be done? That's the way it's been done for 30 years at least. More grafts equals more density. And DHT is no different physically for them to perform. I'm sorry I'm going on the rant, but it just pisses me off.
Yeah,
it's
again, at this point, this poor caller's like, okay, so how do I get help?
I know. We're back to how does this affect me? Okay, so your question was, should you go to Dr. Bunsall at Eugenics? Assuming because you mentioned her name. Yeah. Let me tell you about something. Tell you something about Dr. Bunsall. I love that woman. I think she's fantastic. Not just as a person, but as a surgeon. I think she checks all the boxes. She is a silent duo behind Eugenics. The other one being her husband Pradeep, who's also phenomenal at what he does. But he's more of the talker of the two. He's more of the face of the clinic. She likes being quiet in the background, just doing her work, and she's damn good at it. I'll go ahead and say, like, between the two, like going back to the Cynic guy, I know who he is. Like I'm well aware of his existence. Compared to Dr. Bunsall,
there's a lot of reviews on the internet.
Yeah, fuck the reviews, man.
Okay.
It's your experience.
Yeah, my experience wasn't the best.
Okay, but what about the picture in your head? Yeah, exactly. It's your experience, not the reviews.
Let this guy talk. I understand. I appreciate the passion.
No. These callers are not allowed to talk.
You're correct about having the passion, but let this poor guy talk. So caller, what's your name again, caller?
Wayne.
Wayne. Sorry, Wayne. I should remember these things. I need to write them down. I'm getting old.
I didn't forget your name, Wayne.
So you went in, you went to Turkey, you did your research online, you decided, hey, I'm going to get a less expensive hair transplant. I'm going to take, everyone's doing it. This is it. Let's check this out. You went for the higher package because you want
pictures, with reviews such as realself.com and some other, review sites I've been on. So
I'm going to make it very clear to you. Now I'm going to go on a rant. If you are anyone out there who's considering getting a hair transplant, who goes on realself.com and reads reviews, and you make a choice based on those reviews on realself.com, you're doing yourself a tremendous disservice. I've been in the business for a long time. There was a time when I was asked to do a live broadcast with Real Self. If I continued to do it, we would be a lot bigger as far as doing what we do. And I would be in the mainstream plastic surgery world, all that stuff. I was so turned off by the experience and the people and the bullshit that I encountered. And knowing that I was involved in something that, let's put it this way. I would not send a family member to that site to get any information about plastic surgery or hair transplant surgery. When I know that doctors were telling me, I
agree with you.
Yeah, doctors were telling me that they weren't even answering the questions. They were having their staff, maybe a high school graduate, answer questions for them, for patients on Real Self. I was just like, holy shit, I got to get the fuck out of here, man. This is not for me. So I just want to let you know also, you're not alone, man. Almost everyone makes their decisions based on all of these popular sites and forums and stuff like that. So don't beat yourself.
What about Hair Restoration Network? Do you think that's a good site?
I have no comment.
Spencer?
I have zero comment. All I can say is that I have a message forum called Bald Truth Talk. It's very well trafficked, and I tell the world to stay off the fucking forums. Never make a surgical decision based on any of these hair loss forums or, even my forum. Read the information, check things out. Don't make your decision. You got to go in person. You got to speak to real patients. These are good starting points, but to make a decision based on anything and listening to the fucking peanut gallery on message forums, you don't even know if these are real people. It's insane. I'm in the forum business. And I tell you, don't make a decision based on Bald Truth Talk. It's a bad move. So to answer your questions, no. I do not believe you can get a consistently reliable information from any of these resources. They're all used for marketing. Period.
So how do I do my research then?
They are 100% marketing resources. What you do is you develop a short list. You can go on these sites and you can learn about these doctors. You can go to iahrs.org, which is an organization that I founded. Check that out. You go to Joe's website, hairtransplantmentor.com. Check out the doctors that he is willing to work with. And then once you find a few doctors that you're interested in, then go online. You can look at the reviews. You can go on, that network, and you can go on Real Self. But the bottom line is, once you make a decision like I like this guy's work or this gal's work, then you got to go see the doctor. You got to call them up. You got to meet with their patients. That's how you make your decision.
All right.
But I will tell you that if you're picking eugenics, if you're picking eugenics as a possibility, then you've done some research because they're good in general.
All right. Yeah. The rates are somewhat affordable. Okay, so my hairline is a little bit asymmetrical. I'm just thinking about bringing down a little bit of the left side, perhaps half a centimeter or so, or even down to 1 centimeter, right at the temple area.
Let me ask you a question. What's your background? What's your nationality?
I'm Asian. Okay. I have dark, coarse hair against a pale scalp.
Right. So
and
that's what I was potentially thinking, and that makes your situation even more difficult. So, the coarseness is great. The coarseness is actually beneficial, but the contrast between the scalp and the hair, means that more hair usually has to be moved. And there is a very specific, well, Joe could speak to this because he's dealt with this, but there's a very nuanced way, in my view, to transplant the typical Asian patient. I don't know if you agree with that, Joe.
Thank you, Spencer, for the handoff. I do agree with that, and I think that as an Asian patient, the number one thing that you should be aware of is the need for naturalness. Like every patient should be seeking naturalness first and foremost. But when we're dealing with fair or pale skin and dark brown or black coarse hair, that's the most difficult situation to work with when it comes to trying to achieve naturalness. And the reason being is even a properly prepared single hair graft placed into the hairline can look like a pluggy graft if the density isn't proper. It isn't established the way it should be for cases like yours. In other words, you're talking about a lack of density. Most Asian hair transplants do not look good unless it is a high density. And to get that soft transition zone that everyone talks about when you read forums, that doesn't work for you. And that's
I've heard
one
you
way
talk
that forums
in the past. It needs to be abrupt transition for me.
Say that again?
Yeah.
Wayne?
He said he's heard me say that before.
Okay.
Yeah.
Yeah, that's one of the things that you don't get from any forums because no one understands that. They all repeat what they read from what someone else has said about the soft transition zone. But you can't do that with most Asian patients. You can on some, but it's the exception, not the rule. Whereas someone like me, fine, pasty white guy hair, sure, yeah, you can do that. So when you're looking at the clinic, you got to make sure that they know how to do hairlines. It's not about can they get you the density. They need to know how to do hairlines because if they know how to do hairlines, then they know how to get the right density for each case. Does that make sense?
Mm-hmm. Yeah.
Yeah.
And I noticed that from a distance, my hair doesn't look pluggy, but when I use my hand and press on my hair and press it back, it looks pluggy.
Yeah. Yeah, and that's what most clinics will deliver unless they really know the hairline. And so, there's some questions in the chat or comments, and I think you might have said this. How do I do my research? Well, I think ultimately the best way to do your research, aside from just finding different clinics that look good, is really focus in on the naturalness of the results. And you can only do that by finding clinics that actually accentuate those points in their presentations. And when you're looking at, like, say, eugenics, they have really gone above and beyond. I remember when I first talked to them about this back in, I think it was 2018 when they first came on board with me. I told them, you need to really accentuate your strong points. Like, talk about hairline design, talk about temple points, talk about temple angle transitions, all these things that no one really talks about and forum people don't really know about, and really have an effort put into a high resolution presentation of the actual results that you're talking about. You can talk about it, but if you can't show an example of what you're talking about, then it's meaningless. Like, everyone can talk about it, and you as the patient, you have no idea if what they're talking about makes sense or not. But when you see it in practice, when you can see the naturalness, when they're combing through and each hair just kind of goes back and then forward because of the combing motion, and each hair is individually single in that frontal hairline, and you say to yourself, I can't tell if that's a hair transplant or not, then that's a contender. That's a place that you need to consider. And that goes with any clinic. And when and if you rely on these Instagram photos that so many people are relying on now, you're just going to screw up again, because those photos are compressed. They're always horrible, like almost always horrible. Doesn't matter who it is. And it's just the nature of most clinics don't know how to take photos or shoot video. And if they upload them to Instagram, it ruins most of the effect that they get from doing it right, if they even know how to. So look on YouTube, look on their websites, and look to see if what they can do looks natural. And then, if you contact this clinic, being any clinic that you're interested in, ask them about your particular ethnicity and hair characteristics, and ask them for examples. Show me some Asian guys.
Yeah. And then another thing is,
I'm just going to isolate that. Show me some Asian guys and play that in a loop. I like that. Okay. Go ahead, caller. Sorry.
So, is it true that I need to have at least 2 transplants to receive adequate hair density to create this illusion of density? If it's just one hair transplant, it's going to look kind of sparse, and all my hair is either single graft or double graft. And if I have 2 transplants, that will give the proper appearance, right?
It might. And, first of all, most hair transplant recipients will need more than one hair transplant, period. I mean, the issue that we're having right now with the clinic that you went to is that they made claims that you would have the density that you wanted from one hair transplant, and
made you pay more for it.
And made you pay more for it. And the reason I asked your ethnicity is I was kind of sensing, based on just the way you're responding, that, maybe you weren't Caucasian, and that could make things more difficult. So, with all of that said, if you're normal, if you have normal recovery aspects, I could not think of the word, physiology, and you don't have anything that's compromised as far as, growth, if you go to the right clinic, it's very possible.
I follow everything to the T. I did everything they told me to do.
I'm just talking about your physiology. As long as there's nothing that's...
I'm in good health too, by the way.
That's good. So as long as there's nothing that's impeding your growth, if the grafts are implanted properly, another procedure should help you, especially with the right clinic and the right surgeon, should help you achieve the look that you're looking for. At least get you a lot closer, or you may be done with it. It really depends.
But what about what I said earlier, though, about lowering just the left side by about 1 centimeter?
They can do that.
And then, but then will I need another tear transplant after that to achieve adequate density?
No, not necessarily. If they do it correctly, then that lowering it to that degree could be. It really depends. If they're able to get the grafts per square centimeter, they're doing it correctly, and they're able to create the right angles that creates the right illusion, it may be just fine.
All right.
I'll say this about density promises. What's that?
Okay, if it's higher density, does that equate to a higher transection just because there's more demand for blood supply, and then some of the hair might die off?
The blood supply won't dictate your transection. Transection is when the graft is actually physically cut off from the bulb or damaged.
Yeah.
Well, okay, but won't some of the hair die off though if it's tightly packed together?
Not necessarily. It can, though. Yeah.
It can, but that's not transection. That's just too many grafts in one given area competing for blood flow.
Yeah, I'm not talking about transection anymore. Yeah.
Yeah. Look. The practice of creating density, whatever that means to you, is not easy. If it was, then every doctor would be able to do it easily, and everyone would be happy. There are a lot of variables that go into creating density. One of them is what you talked about, the blood flow issue. How much blood flow interruption is there in a given area because X number of incisions were made? That's a big deal. So the doctor that's making the incisions has to understand the limit based on observation. So when a doctor that has a lot of experience starts making the incisions, they actually watch the blood flow through the incisions, like how much you're bleeding. Is there a healthy blood supply, or does it seem like it's a little bit restricted due to whatever reasons? Not a whole lot of capillary formation in that specific area. It could be a number of reasons why, but that's just one variable. Guessing, basically, visually, what the blood flow situation is like, and only experience can dictate that. And even then, it's not 100%. Another variable is your skin type. Can incisions be placed very close together without causing the connective tissue in between from disintegrating, creating a really large incision? That's a second variable that no one knows until the incisions are starting to be made. But in general, if you go to a good clinic that has demonstrable great results as far as one-pass density results, which is what you're looking for, and they have the proper endorsements or validation, third-party validation like American Hair Loss, IAHRS, if I work with them, or a few other, I'll say, validations out there, then that's a great place to start. And you can feel better about the idea of maybe getting an acceptable density in one pass. But when you're talking about, you ask a question, do all hair transplants require 2 passes? No, they don't, because I think that when you go to a really good doctor, even if they tell you that you'll need 2 passes to get the right density, assuming that your expectations are in line with reality, that first procedure will still get you pretty good density, to where it's like, okay, I'd like it to be a bit more dense, but I'm pretty happy with this as it is. It's more of an option, not a requirement. That's the general expectation one should have when they go to a top-tier clinic. But if it's an issue where you're just like, yeah, there's not much density, then there's a communication failure there as far as the actual outcome that you should expect. So ultimately, when you're dealing with the search for density, and you're asking Spencer about, if they lower one side of my hairline, will it need to be two surgeries? Probably not, because the temple region where there's a transition in the corner of the temple, it doesn't need to be high density to begin with. Not super high like the frontal hairline. There's always a little bit less density in that area anyway, and as it comes along the side to the center hairline, it's usually not an issue. If you're one of those people that's super picky, the density on this side isn't quite the same as the other side, and it really bothers you, then you need to temper your expectations, because no hair transplant has equal density from one side to the other. And along those lines, no hair transplanted hairline, or no hairline in general, is perfectly symmetrical either. There's always going to be some sort of slight lopsidedness, at least to some degree, and some variations in density in different areas of a hairline.
All right. Okay, in terms of symmetry, I was thinking about using a piece of paper and drawing out my hairline, and then folding that paper in half and then cutting it so it matches. And then when I'm at the clinic, I can use a little cosmetic pencil and just drawing it onto my forehead there. Would that be a good idea, so I can get the symmetry I'm looking for?
No.
No, that's a bad idea.
It wouldn't, because it's a very imprecise way of measuring, I'll just say no. Spencer said no. You need to trust the doctor if you go to a top-tier clinic. Obviously, question everything, but when you tell them what the issue is, what you're there for, then they know to focus on that, and they're going to give you the opportunity to judge what they've drawn on your scalp. They'll hand you the mirror and say, "Do you like this? What do you think?" They like it because they drew it, and they want your opinion on it, but it's up to you. And it's up to you to say, "No, I think that this side's a little bit too high. Can you drop it?" And they'll either agree or disagree, and they'll tell you why. That's part of a good clinic, is communication.
Jesus, some of these Instagram bras are unbelievable. Sorry.
Okay, what about the temporal point? My hair thickness is very uniform all around the nape of the neck, the behind the ear, very uniform. Is it possible to create temporal points for somebody like me?
It is actually more difficult because of the coarseness of your hair.
Yeah, it's very coarse all around, very coarse. And then pale skin too.
But you're sight unseen, so maybe you do have some hair that can be used. I don't know, but that's something that's between you and your doctor when you do your consultation.
Yeah. Okay. And then another thing is, I was thinking, after I have my hair transplant, do you think it would be a good idea to be placed in a hyperbaric chamber so that would aid my recovery and hopefully more hair will survive?
Spencer?
Oh, I'm sorry. I was looking at these images. Holy shit. Some of these bras are unbelievable. Hyperbaric chamber. I do know a lot of doctors, or a few doctors, who really believe in putting their patients in the hyperbaric chamber. But I would say that unless it was provided by the clinic, I don't know if you need to spend money on that. I don't know. I can't say for sure. There are a few doctors, one in particular, who wholeheartedly believes that this is going to improve your results, and it will increase the potential for a more rapid growth, or potentially eliminating some of the shedding of grafts. But honestly, I believe that a good hair transplant is going to just survive. Your hair is going to grow normally, and you're not going to need any extra bullshit.
That's what I was going to say. It's like a good surgical procedure, a good surgical technique doesn't need a hyperbaric chamber to ensure success. No offense to anyone that recommends that to their patients, but that's the way I look at it.
It doesn't hurt, though.
I know a guy who provides it for included in the surgery, so it's great. Like, hey, you want to come in the hyperbaric chamber? Yeah, then come on in.
It doesn't hurt.
And how do you think I look so young? Sorry, go ahead, Kohler.
Finasteride.
Who do you think got Michael Jackson's hyperbaric chamber at the auction?
Damn straight.
Damn straight.
Well, what about some doctors recommending spraying your scalp with some, saline spray after the transplant, and then others don't recommend it? What do you think? Do you think that's helpful or not?
Joe?
I'm a believer in dry healing. Like,
that's where we differ, man. That's where we differ.
There's actually an argument against using sprays, such as saline spray. And that argument is, what if an area of your scalp develops some sort of infection, some sort of folliculitis? When you're spraying your scalp with anything that's not antiseptic, the fluid runs over the top of your scalp. It doesn't just spray and stay. Like it does bead up and then creates rivulets that will maybe move around, and it could potentially spread the infection. If it's an antiseptic type of spray, then that's no problem. I know some clinics that will recommend a mixture with
betadine,
a very small percentage of betadine, iodine.
Iodine, yeah.
And spray that, and that's fine. And that's designed to help keep the scalp free of infection. But I'm a believer in dry healing because the body itself, I mean, it's designed very efficiently to fight off any little bugs. If you have a super bug, no iodine is going to help. Like MRSA, if you get an actual legitimate hospital super bug, and I've seen this happen, then your troubles are much worse than what can be handled by a little topical antiseptic. So about the question about saline, I don't think it helps, but that's just my opinion. I've seen too many cases of dry healing to know that there's no problem with it.
I think dry healing works, and for a lot of physicians, they just recommend dry healing. But in dermatology in general, and for any dermatological surgery, and again, we're talking about thousands of wounds here, so it could vary, but moist healing seems to provide a faster healing environment. That's across the board. But Joe's right as far as potential of infection, and so I guess it's going to be up to you and your doctor.
And ultimately, that's what it comes down to. Always follow your doctor's instructions.
Follow your doctor's advice, because I know guys who they believe in dry healing. They just let it scab up, and they do perfectly well. And I also believe in people who actually, they're telling people to put like vitamin E or Aquaphor or something on their scalp to really grease themselves up and kind of create this barrier for healing, which is a mess, but they believe that that's going to be more effective. And then there are people who actually create salves that have like growth factors in them as well. And they probably charge you for that. But in the end, if the transplant is performed correctly, all you have to do is sleep properly the first couple of nights and let the healing begin.
Okay. Well, what about, let's say after 2 weeks or so, after I had my hair transplant, should I apply minoxidil to increase blood flow? And
no.
That will help in...
not doctors, but do not do that, man. Let the transplant take. Don't fuck with it. Don't add minoxidil. I mean, there are some doctors who may say, okay, do it or recommend it. I think maybe they're doing that as some sort of insurance policy to make sure that the grafts grow. I don't even know why they offer that, because you're creating an environment that could be, in my view, detrimental to really growing the grafts well. So again, I'm not a doctor. It's just my view. If you don't have to be on minoxidil, don't fuck with it, especially within weeks of surgery.
So just leave it alone. Don't apply aloe vera. Or
just like your mother would tell you, don't pick at it. Just leave it be. And it'll grow.
Don't pick at it. I like that. Don't pick at it. That's exactly right.
Don't pick at it. All right, dude, listen, we're going to take another caller. I hope this call helped you. And
it did. I think I'm going to go to eugenics. I'm not going to go back to Dr. Cindy.
Look, if someone fucked me up, I wouldn't go back.
All right. I would give it a grade C. I don't think it's terrible, but it's not up to my expectations.
You know what? How much did you pay for it?
I think $3,500.
Okay. So if you would have paid $10,000 and you got a grade A, would you have been happier?
I would. Yeah.
Okay. Lesson learned. But the good news is you're probably going to be just fine. You weren't totally botched or anything, and your second procedure will most likely get you to where you want to be.
I hope so.
All right, man. Good luck. Let us know what happens.
All right.
Okay.
All right. Thank you. I
Take care.
appreciate all your help.
How'd I know he was Asian, dude? Tell me how I knew that.
Because you're... I have no idea. I don't know. I don't know.
Dude, just like you have gaydar, I know these things.
You mean I was right?
888-659-3727. I know you wish that, bro. No homo.
You want?
Hey, you're on the air. Who's this? Hey, caller. Caller, you're on the air. What's up, man? I'll give you a second to say hello.
Hello?
Hello.
Hi, can you hear me?
Yes. Who's this and where are you calling from?
My name is Jacob. I'm calling from Florida.
Hey, Jacob from Florida. What's up?
What up, Jacob?
Hi, nice to meet you.
Nice to meet you, too.
I just wanted to say to thank you to both of you. A week ago today, I got a hair transplant and FUT procedure down in Miami with Dr. Aaron Nussbaum, and it was a fantastic experience, and I don't think I ever would have found him if it hadn't been for articles that you guys had written about, top hair transplant doctors and videos that Joe, you've made. So I just wanted
to let you know, I didn't write that article. There's another Spencer. His name is Spencer Stevenson. He's in the UK. So he's the guy that does the top 25 hair transplants.
Thank you to him.
Yeah, but he's on the show
but
too.
We all know he's actually behind the scenes pulling the strings.
Yeah, apparently I'm the guy that's pulling all the fucking strings. That's what the doctors are saying. But no, Spencer's on my specs, or Spencer's on my show, on my show, is on the UK show with me. And a lot of people get confused. But yeah, I'm glad that you were able to find Dr. Nussbaum.
Yeah, well, that's pretty much it. Just wanted to say thank you. It was a great experience. The entire thing. I'm very happy with the design of the hairline. Healing is going nice, and I would definitely, obviously I'm not a doctor, but I had a great experience there, and I can say that everything I've read in those articles and those videos that you made, Joe, has been true, and just it's been a great experience. So
well, don't thank Joe until you're a year out. But I am
You're
glad.
Absolutely right. Yeah.
But I am glad that the experience, obviously the experience was a good one. The likelihood of you having an appropriate outcome and the outcome that you're looking for is very high, going to Dr. Nussbaum. But you never know in life. That's just the way that it is, especially with hair transplant surgery. But and that's why. And again, I appreciate you calling. I never loved the idea when you go online and you see all these people with a thumbs up right after surgery or a week after surgery saying that they wholeheartedly recommend the clinic, when in fact you really have no idea what your end result is going to be. But in your case, I know Dr. Nussbaum well. I know his father, Bernie. He comes from a long line of hair transplant surgeons. The guy's been essentially in the saddle since he's a kid. He's been involved in this industry forever. So you're gonna have a great result, in my view.
Well, thank you.
All right, man. Listen, anything else?
No, that was it. Just wanted to call in and say thanks.
Well, good luck. Right. Let us know. Call us back in 6 months and let us know how you're doing. Or if you have any questions, call us before.
All right. Thank you.
All right, man. Take care. Bye-bye.
Thanks for calling.
888-659-3727. I don't think Aaron would mind me telling this patient the truth. Like, you don't know what the fuck is up right now.
No.
Everything seems okay. Probably will be okay. But call us in 6 months to confirm.
It's just being honest. You never know.
Never know, man.
And he would have no problem with that. And that's a great thing about the docs that we work with. They don't mind the truth being told.
I know.
And that's the truth.
Unlike the doctors
ultimately, it turns out great.
Unlike the doctors in this message group that we belong to, who just throw patients out. We can't do surgery on you. Why? Well, you're not a candidate. Boom.
Bye.
Bye. Good luck. It's just unfucking believable. Hey, you're on the air. Who's this and where are you calling from?
Hello?
Yeah.
Hey, my name's Robert. I'm in Sacramento. I spoke to you guys, I think it was 2019. I was living in Milwaukee at the time, but I'm 61 years old. I'm in decent health. I've been thinking about getting a hair transplant for a long, long time, and one of the issues that I'm having right now is I heard you guys mention before that nobody will really do surgery if you have any kind of scalp-related issues. And so I got back on minoxidil, the Kirkland brand, and I first started with the liquid in the eyedropper, and that gave me the world's worst contact dermatitis / dandruff that I've ever had in my life. It was so bad that I just, I wanted to rip my skin off. And so I stopped doing that one, and I went to the foam, and it diminished about 80%. Now, I am using the ketoconazole shampoo 2%. I just started using that about a month ago. Before that, I was just using the 1%. So it's like, what's your input on all that with minoxidil and the contact dermatitis and whatnot?
It's very common, and you have to really find a formulation that doesn't cause you to have these type of inflammatory effects, and they're out there. So it's really a thing of about trial and error. The problem is you need your scalp to be totally healed before you go on to the next product.
Yeah, totally. No blemish, nothing, no kind of dermatitis whatsoever.
No dermatitis, no cracks in the skin, no issues, whatsoever. You have to have a completely clear scalp. Let it heal up before you go on to the next product.
I've been doing the microneedling also with it, which, I've gotten fairly decent results. I've been doing this now for 6 months, and I stopped using the Rogaine probably in 2012 because I started using a Topic type product, and it was, in hindsight, it was not the right call. I should have, kept on using something. I'm also kind of really afraid of the finasteride because of the fact that I've seen, I'm sure it's rare, but some people have had problems with the gynecomastia, and I've always been a little bit more prone to fat in the chest area.
You see the size of Joe's tits? Holy shit, look at those.
I guess not.
No, man, look, it's a possibility. It's a possibility. I mean, it's a relatively rare possibility, and just because you are prone to having a heavier chest, it doesn't mean you're going to have gynecomastia. Totally different situation.
Well, is one like
I think one thing to consider, sorry to cut you off, but one thing I need to ask is when you're doing your microneedling, you're doing that now?
Yeah.
Okay. Are you sanitizing your needle roller or stamp every time? You are? Okay.
Yeah.
All right.
Yeah.
Because that could also be an issue, and I don't recall ever seeing any. Maybe I have. I don't recall it. Seeing anyone talking about microneedling and then saying be sure to sanitize it in between uses. None of these guys online that talk about using. Yeah. Okay. So good.
No,
That's
I
a good.
usually let it soak in alcohol for about, I don't know, 20 minutes before I use it. So, and then even after I'm done, I put it back in the alcohol and let it soak. So, I hope that's good enough, but that's what I do.
That is good enough, sure.
With the studies on the microneedling, it's kind of like in a gray area. Again, you're watching YouTube, you're reading stuff online and whatever, but the bottom line comes down to, like, you see the studies, and allegedly microneedling is supposedly better than minoxidil without any minoxidil, and then it's supposed to be 1.5 times better microneedling plus the minoxidil. So that means, I guess, that if I just did the microneedling, that it would be just as good as the minoxidil, and that means that those results you have to microneedle for the rest of your life, or what do you guys? How have you read into that whole situation?
I can tell you that I have never known anyone who's microneedled that's had long-term results or who's stuck with it. I've seen some really impressive vellus hair and in some cases some hair that looked like it was going to start to become terminal, but they always just disappear offline. No one in my life or in my world has ever had long-term success with microneedling. It's a major effort. Now, it's obviously the effort is worthwhile if you're going to have significant results. But if you're just going to have peach fuzz or some degree of growth, if it's not going to affect the native hair that you have that's, growing or that's starting to miniaturize, then I kind of see it as a big waste of time. Joe, I don't know how you feel about that.
I've seen, like Spencer said, I've seen some impressive vellus development, but I do have a personal experience with wounding, not specifically microneedling, but wounding of an area and how hair growth can and does result. And that was 3 years ago. I wiped out hard on my bike, on my road bike. I'm screwed up my knee bad, really scraped it bad. Healed up. It took several weeks for it to heal up. Big scab on it. It was ugly, nasty. Once that thing healed, I still have a patch of hair that wasn't there before. Compared to my left knee, my right knee has, I could comb it. That's how much hair there is. And it was from superficial wounding, but the same concept that you're going for with microneedling. In fact, if I had this result on any part of my scalp from microneedling, it'd be a resounding success.
Yeah, but that's like taking a fucking cheese grater to your fucking skin, basically.
Well, I was going to follow up with that being said, don't drive down the street and have open your door and just drag your head on the concrete or the pavement. It doesn't work like that. But what I'm saying is that there is validity to the theory behind it. I've just not seen any sort of actual results from that approach that are worth going through the pain and suffering of getting.
And Carl, I don't know if you have any other questions, but I want to address something that I just read in the chat room. So you could hold on for a second and we'll answer the rest of your questions. I want to address hair loss experiences. Now, I could be incorrect about this, but I have never claimed that people who own farms or people who run farms don't know what they're talking about. What I did state during this conversation was that you don't know where the information is coming from. You don't know if there are real people who are answering your questions when it comes to hair transplant surgery. And in my view, if you're making a decision to have hair transplant surgery based on anonymous users on a forum, you are not doing your due diligence. And I have a forum. So, there are some good people who are in the forum world, and there are some not so good people in the forum world. But my point of contention is that I don't believe that anyone should get all of their information from any message forum, even if it's the best message forum in the world, to make a decision to have surgery. I don't think that's a bad point of view. So hair loss experience, I'm sorry if you're offended in some way, but this wasn't, a comment that was pointed to you in particular. It was about forums and review sites in general for any form of cosmetic surgery. Go ahead, Joe.
Well, I was just going to say, in case people listening to this or watching this don't know what hair loss experiences is, it is a forum based in the UK, but they do have, I'll say, global participation from various clinics.
And it's one of the few good ones.
And I will say that they're one of the better forums out there.
Yeah.
I like the forum, but my point about forums is to address specifically what he said. He says, not all forums and the people involved are the same. Some genuinely are knowledgeable and genuine. And that's true. But the problem is, as a consumer, when you're looking at other members taking part that might have a lot of understanding of what's going on, they're still anonymous. And we don't know what their background is. And I'm talking from a layperson's point of view. We don't know what their credentials are. We don't know what their experience is. We don't know if they work for a clinic and are giving their biased input based on their experience. We don't know if they have any actual experience and they just know how to string words together to where it sounds legitimate, or if they're a shill from another clinic. No one knows. And as forum, we'll say, administrators, there are differences big time, and I will say that I won't name names, but there are some where they have almost no interaction with clinics, and they don't really understand what they're talking about. Like I remember seeing one forum person that was talking to a doctor online, and the doctor's speaking about some not really high level stuff. But I could tell that the guy interviewing him had no idea what he's talking about, because he didn't have follow-up questions along the same subject line. He kept going back to other questions that people had asked asked him to ask the doctor, and he was out of his element. And so when people are looking to people like that, when members are looking to people like that for really safe information, I don't think that people like that can give it, because they don't really know what they're talking about. They're just repeating sound bites that they hear from clinics or from other patients that they don't know who these people are. Look, so there's a lot of question marks.
The bottom line is, if you're making a decision to have surgery based on a review site or just reading information on a forum without doing your own due diligence, then you're an idiot. That's it. And anyone who disagrees with that, in my view, is being disingenuous. Now, I happen to like very much hair loss experiences. And if I'm going to tell somebody to go to a forum, that's a forum I tell them to go to, period. But I still have my stance, and I think my stance is very reasonable. And, I'm sorry that if anyone took that, personally, they shouldn't. We know this industry. It's a really fucking bad place. And there are people who are in the hair loss forum business who really created the evil in this field. Hair loss experience is one of the good guys. That's it. I just wanted to put that out there because I saw the comment. Caller, sorry about that interruption. Did you have any more questions?
That's cool. Yeah, quickly, I have been looking at eugenics myself also, and I noticed that Dr. Pradeep, his results usually are, his stuff looks like it's pretty dense packed as far as when it comes to how many transplants he'll do at one time. I mean, he's doing BHT and he's doing, regular scalp grafts all in the same procedure, and it seems like he's doing more than most of these other people, except for probably that guy in Bulgaria who I can't remember his name. That
Zarev.
The Bulgarian.
Zarev.
Who was? Yeah. Anyway,
you always got to one-up me with the pronunciations, right?
Zarev. We could both be wrong.
Yeah, Zarev. That's his name, Zarev. Yeah. But in any event, how are they able? I mean, again, I've heard you guys both say that everybody's comfortable with what they're comfortable with. So it's like, is this a different skill level, a different skill set? Is he lucky?
It's a different skill set. It's his ability. It's preparation. It's a level of hand-eye coordination. He's in incredible shape. He's able to work as a machine, like a machine. He's ambidextrous, if I'm correct about that. I think I am. I mean, there's a lot to it. I mean, look, not all human beings are created equal, and even if they go to the exact same schools, they have the same training, whatever it is, there are those who can do, there are those who can just teach, and there are those who could do better than anybody else.
Was the caller asking about Zarev or about Pradeep?
Oh, no, about Pradeep. I was actually focusing.
Okay.
The other guys, his prices are really at the high end of the spectrum. But with Pradeep, I see at least a couple years ago, he had a thing on there where he offered 3 different levels of transplant, and one was, I guess, with a doctor that he had there that wasn't him, and then one was with his wife, and then one was with him, where he actually did all the placing of the grafts, and of course his level was the highest cost. So I mean, of course. I don't know. Would I feel comfortable getting one of his doctors that aren't him to do anything like that for me? I mean, his wife is very well capable, I suppose. If it was Joe or
she's great.
Yeah.
You know what? I won't talk about conversations I've had behind the scenes with Pradeep, but I'll just say that his wife, Dr. Bansal, is fantastic.
Okay.
I won't say which one's better, but I will say
Joe's got a little crush, I think.
that she's fantastic. Oh, I like her. I like her a lot. I like her a lot. Yeah, she is. How can I put it? She's the one that drives the details of a lot of what they do, and I'm talking surgically. So I think that a lot of what you see with the fine detail of their results, a lot of it comes from her. Even if she wasn't involved in surgery, it comes from the standards that are set and the protocols that they've established for what they do. You can't go wrong with either one. It's like people would contact me when I was working at Hassan and Wong. They'd say, which one's better? It's like, toss a coin. It comes down to what you like about what you've seen in their results. And you can talk to the clinic and say, I would like to see just Dr. Erica's results, or I'd like to see just Dr. Pradeep's results, and they'll do that for you. So you can feel better knowing that what you're seeing online is from one doctor or the other. I don't think they do that on their website. I don't think they delineate who did what. But you can ask that. I'm pretty sure that they'll help you out.
If you were to go to another country, like, I'm not going to Turkey because I've heard just way too much bad stuff there. But if I went to India and had that procedure done with them, how long would you stay in the country? Would you stay a couple days, a week? How long would you stay after the transplant to make sure everything fine?
Well, if I went to eugenics for a hair transplant, they wouldn't let me leave earlier than a week just because they'd want to take me around and show me all the great sites and feed me and
you also have a great place to stay there.
This before. Yeah, and they got a great place to stay. Not just on site, but they got a place up in the Himalayas, along this massive river. Yeah, yeah. But if I was there if I went anywhere for a surgery, if I was a new patient, like I didn't know what to expect, and I want to make sure I got the best care, didn't matter if it was Pennsylvania, I'd stay for a week. I'd be bored to death. No offense to people in Pennsylvania, but yeah, I'd stay for a week.
You can go cow tipping or something.
go look at the Amish. Yeah, I'd want to make sure I'm there for the first several days of recovery, because that's what's most important. Your grafts haven't set until about a week after you had them placed. So I'd stay. Now, knowing what I know, I'd leave within 2 days. If I just wanted to get back, I'd be able to, because I know how to take care of a hair transplant. I've had so many. It's nothing new for me. But if you're not experienced with this and you want the best care possible, shell out a few extra bucks and stay a week.
For sure, man. I agree with that 100%. All right, caller, listen, we're going to let you go. Feel free to call back if you have any other questions. We're on every Friday.
Okay, cool. Thanks.
All right, good luck. Take care.
Thanks for calling.
I'll take one more call.
Yeah, let's do it.
All right. Hey, you're on the air. Who's this and where are you calling from?
It's Morty from Brooklyn.
Oh, the one more call I take.
we wind it up with Morty.
What's happening?
Yep. Not much, man. I'm doing well. I just got back from 2 weeks in Coffeeland, Colombia. Had a ball. Enjoying life. On to my 4th month right now. And
has it been 4
morning
months
is a
already?
pleasant surprise.
Holy smokes.
Yep.
Wow.
All right, so tell us what's going on at month 4.
Okay, so month 4, it's kind of like the emperor has no clothes, because I'm looking in the mirror and I am.
You mean like what's happening with our country right now?
Growth.
What? Sorry.
Hey, you don't have to apologize to me. I'm kind of agreeing with you on that one. But in the sense that, like, I'll look in the mirror and there'll be more hair than literally the day before. I mean, that's kind of what I'm experiencing now. I am so, like I said, I'm so over the moon about this. Today I had a friend of mine fly in from Texas I hadn't seen in probably a couple of years, and I'm like, guess what I had done? And I rip off my hat, and she's looking at me like I'm crazy, and I'm like, and I'm like, I had a hair transplant. She said, you did? You should have told me that. And I'm like, she said, because I thought it was obvious, but it's not, because it's still very thin yet, and it's
right,
and it still looks very sparse, but it's there.
She's like, what?
And
you're losing your hair? I've known that forever. That's what she's thinking.
Exactly.
That's good.
Yeah, you're bald. What else is new?
Yeah.
Okay. But overall, I'm seeing the growth. It's coming in. I'm still getting these lumps of inflammation with small wounds in the center. They some of them are really like kind of thick and big, and then they'll take a good 4 or 5 days to resolve. And the results are big, there's big wounds, which isn't pleasant, but I mean, they seem to resolve, and hair's coming in. So I'm just, like I said, it's month 4. So I know this is still very early days, but I can actually see an outline of, where the work was done. The hairline is starting to become more defined. Obviously it's still very, very thin. But I'm very pleased, and I'm just, like I said, it's exciting. It's very exciting to see things growing.
Of course, it's exciting,
it is.
man.
Good for you.
You've been like Formica, like a Formica top for what, 20 years?
Yeah, more than that, I think, because I started losing my hair when I was. When I was about 19 is when the hair started coming out. I still remember the day I'm lying on top of my girl, and she's running her hands through my hair, and there's hair coming out in her hands, and she just has this look aghast, and I'm like, oh, it's nothing, I'm just losing my hair. And then the expression on her face changes even more.
Oh, yeah.
And that was kind of the end of that.
And all of a sudden it's like, you give her a call, and she's not picking up. And these are the days when you had a wire on your phone, right?
Yeah, sure, man. I actually did I have a rotary phone at that point? No, I already had a push button, but still, I mean.
Dude, I went out with this chick. I was like 21 or 22 years old. Chick, I mean, she fucking loved me, pursued me. It was insane. And for whatever reason, that day I decided to comb my hair back a little bit more. And she's like, I think you have a receding hairline. And I'm like, I think I do too.
Wow.
And then we're eating whatever it is. Never heard back from her. I'm telling you that this person spent a month pursuing me.
Yeah.
So
what was his name?
That's when I learned. I'm just going to file that away. That's when I learned that this is not a good situation.
Yep. No, the other thing I wanted to point out, and so for the listeners, first of all, shout out to Rob Helmer. He's like, you got to call in. He knows that I was away 2 weeks, and I was chasing a dream, a Colombian dream, and it was fun, but it didn't end well.
Oh, that's right. Yeah.
The interesting, yeah. So it was fun, but it didn't end well. She kind of she flaked, and I was like, all right. But the interesting thing about her was she didn't want me to have it done, and
well,
now
yeah, because you got more hair, then she's
have
afraid that you'll be more attractive to other women. She was afraid of the competition.
And that was the whole thing. She freaked out because I flew back to Florida on Friday, and I had dinner with my friend Jackie, who is a woman, big surprise. And she took a selfie of the two of us and put it on social media. This woman had the fucking connection. You're cheating on me, this, that. I'm like, and I'm like, you've got to be kidding me. I just spent 10 days with you. I mean, what the fuck? So she's like, that's it. I'm done.
How much money have you given her so far, Morty?
Dude, I don't want to fucking. Well, let's put it this way. I don't even want to go there. But
Okay.
let's just say.
So why do you think Why do you think she doesn't give you any, and then she's like, "You're cheating on me," because she needs another fucking payment. That's how it works, my man. I've been telling you this for how many years have you been calling the show?
Morty.
Oh man. Well, that's the thing. It's like, dude, I mean, you're gonna dump me like that, and then expect what?
She's expecting another check. That's what she's expecting.
Yeah. No, that's probably true.
Yeah.
But I'm done with that shit. I'm done with that. It was fun though. I got to tell you, man. That shit was. Ooh, man. It was like an amusement park, bro. That's all I'm gonna say.
Well, did you have sex with her?
I didn't just finish telling you that it was like an amusement park ride.
With you, I have no idea what that means.
Well, we don't know if it was emotional, if it was if it was literally.
Oh, it was no, dude. She was amazing. I mean, there's fucking fireworks and shit. I mean, it's like ticker tape parades and stuff. It was great.
Good for you. Well, at least you enjoyed that. It's worth whatever payments you had to make.
Oh my God, dude. That's
Look, I'm a believer in that.
Hey,
I got no problem with that. You know what? It's quid pro quo, and there's nothing wrong with that in life, because in the end, you're going to realize that it's all the same.
Yeah. The sad thing is that I actually met her parents, dude. And it's just like, well, if I'm meeting your parents, yeah, you know what I'm saying? I'm meeting your parents, and the dad's like all nice and everything, and he's got a little woodworking shop, and I bought him a Dremel tool, and he fucking loved me and all this kind of stuff, and I met the mom, and
maybe the mom put the kibosh on it.
Shit.
Maybe she's like,
who the fuck knows?
She's like, I don't like that Morty. Don't like him.
Yeah, who knows, man? Who knows?
Is she Jewish?
But no. It's Colombian. She's straight up Colombian. She's from the mountainous regions. I went to the city of Manizales. I tell you something, fucking.
But aren't you a Sephardic Jew?
This is real, bro. No, I'm Ashkenaz. Well, actually, my mom was Colombian, converted. So.
Oh, okay. I knew you were Spanish.
Yeah. Mm-hmm.
Okay.
So, but yeah, it was cool, man. It was a good trip. It's weird. You go to like 2,200 feet, and you get altitude sickness. I got some serious altitude sickness. It was weird. Have you ever had that happen?
I have not.
Dizziness and yeah. Well, you're down in Los Angeles. It's low ground. Same with New York. So it was. First couple of days were a little bit sketchy, but after that it was all right. My pulse was kind of high, and I didn't want to know what my freaking blood pressure was doing. But I'm back, and me and good old John Peter Cole are going to meet up tomorrow.
You're kidding me?
We're going to hang, see what's what. Yeah. Well, we're freaking thick as thieves, man. Me and John. So. He's got this new toy called EM Sculpt, And you know me, I'm Mr. fucking
Yes.
guinea pig, so I'm trying it.
How's it working so
we
far?
got another set.
Have you lost weight? Have you noticed some changes?
Oh well, it's. I guess it's difficult to say because I took a 2-week break. But there were times I look in the mirror and things look a little bit better. But it typically takes. They say it takes about 90 days from final treatment.
Yeah.
And since I'm breaking in the middle, I'm kind of breaking protocol. But I can tell you that it fucking works you, man. I mean, it's like you're in the fucking like 1950s electric chair, man. You start shaking like crazy.
Wow.
So yeah. John hasn't tried it himself because he had to have some work of his own done on his gut. So he's gonna try it himself, I suspect, once he's healed up.
Dude, you know what I'm a believer in? Cold hard steel.
What?
You can have cosmetic surgery of any kind. You got to get cut for it to work out the way you want it to, in my view.
No, you're not wrong. I mean, it's definitely the most effective. Like, if you want to get rid of some fat, just fucking cut it out. You know, totally get it.
You go to someone who really
you know,
understands how to do lipo, and you get that shit done.
Mm-hmm.
And that's it. And you know what? You take the extra and you put it in your dick. I'm just kidding. People do that. People do that. My urologist started to do something where they're putting filler in your junk, and I'm getting these emails. I'm like, wait a second, am I on the list?
You're on the list.
That fucking urologist, what a prick bastard.
You know?
I'd be like, dude.
So it's getting a little sensitive there after the
confidence.
After the fourth email on the same day.
I believe. Are you like selling? You're selling pictures? Spencer Kobren has a small penis. Go ahead and send him advertising.
I'm apparently on that list, Morty. I don't know how that happened.
Oh no, the itty bitty dicky committee.
Yeah.
Oh Lord.
All right. Well, on that note,
we're Jewish. It's
Okay then.
That's a myth, Morty. Don't perpetuate the Jewish myth about that.
Stop reading bathroom stalls.
Haven't you ever seen pictures of the Holocaust? A lot of hung guys out there.
Oh.
Oh no. Oh man. So here's
I can say that I'm Jewish.
So if you're on 5 ARs, right? So you're on 5 ARs, and then your woman decides to do a little oral on you. Is she in any danger?
Of what? Is her head going to blow off? What are you talking about?
Of a bad joke. I don't know. That maybe that maybe her hair will fall out or something. I don't know.
Maybe it'll actually help her.
Yeah, right.
Unless she's pregnant.
Oh man. Well,
no, actually, there's no evidence that it actually affects your sperm in that respect. So it's not like she's handling the pill herself. But yeah, that's a funny ending to the last phone call we're ever going to have, Morty.
All right, guys, listen. Well, I hope that's the last one you're going to take of mine. It's the last of the night.
So. Now you got it. It went over your head for a second. All right, dude. And of course, we love you, man. You are the best.
All right, guys.
We love it when you call,
Thank you so
man.
much for being there and for, I would love calling. Otherwise, I wouldn't keep on calling. I love you guys. I mean, I wouldn't have made the connections that I've made and done the work that I've done without you guys. So, hats off to you guys. Have a pleasant weekend, and we'll talk next week.
All right, Morty. Listen, thanks for the call. Congratulations on the early growth.
Yes.
All right.
Can't wait to send you pictures.
All right, take it easy. Bye-bye.
Okay, bye-bye.
Thanks.
All right, Joe, I think we are finished. Would you like
we are finito.
to give out the website as quickly as possible?
International Hair Loss Association. That's IHRS.org. Great place
what
to
the
start.
fuck is the International Hair Loss Association?
I didn't say. Did I say that?
Yes, you did.
I didn't say that. I said International Alliance of Hair Restoration Surgeons. Play it back.
Oh, I will. I'm going to put that on the loop.
Oh, I will. IAHRS.org. It's a safe place to start your search for the hair transplant surgeon for you. And also American Hair Loss Association. That's AmericanHairLoss.org. Or is it also AHLA.org?
No, it's IAHRS.org. That's what it is. I'm sorry.
American.
Oh, it's American.
Loss.
I'm sorry. I'm reading the form. I'm reading the chat, and I'm dumb. It's AmericanHairLoss.org.
Yes. If you're looking for the de facto standard that big media references when they're writing any story, any blog post, or any article that's not just online but also in print, they will reference American Hair Loss Association as a validation for what they're saying. That's saying a lot, actually. It's a big deal. If you're listening to this podcast, it is being broadcast live on video on my YouTube channel. That's youtube.com/hairtransplantmentor. You can also check out my personal website with my journey, my own hair transplant experience, and the doctors I work with, as well as the largest and most comprehensive dictionary and terms and definitions regarding hair loss and hair restoration on the interwebs. That's hairtransplantmentor.com. There's also 8togentlemen.com, where the UK or Bald Truth UK is broadcast. I think some clips just went up while we were on air from a call that they had with Spencer Kobren and Spencer Specs Stevenson. Those are usually aired every Friday as well, I believe.
Mm-hmm.
And you know what? Let's go ahead and mention Hair Loss Experiences. This show was broadcast through their forum today as well. Give them a little bit of props. And finally, Hair Loss Cure 2020. Great website if you're looking for information on treatments and
love
future,
those guys. Fucking love those guys.
Future,
they do a great job.
Future possible cures. And they talk about hair multiplication and the whole cloning stuff. Hair Loss Cure 2020. Is it org or com? Hang on.
I think it's
I don't remember
.com.
which one that is. I think it's .com, but let me just. It is .com. Hair Loss Cure 2020. .com. Those are the websites. Back to you, Spencer.
That is it. That guy does a phenomenal job, I have to say. Yeah, guys, thank you so much for hanging out. We will be doing the show next week. We may be on time. I don't know. We have to figure it out with Joe. Hello, this thing on?
What's that? I was reading the chats. What?
Nothing.
Different time next week? What?
Nothing.
Is that what you're saying?
Same time. Same bat time, same bat channel. Until next time,
there you go.
Be strong, God bless, and thank you so much for listening.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid.